Hello, I'm Dr. Clint Sexton, and today I want to talk about autoimmunity and the COVID-19 virus. So if you have an autoimmune disease, it doesn't put you at higher risk from a mortality perspective with regard to the virus, but what can happen is if you do have an autoimmune disease and you do get the virus, it can lead to an exacerbation of your symptoms associated with the autoimmune disease, or essentially cause a flare-up of it. So with autoimmune disease, what's happening is that the immune system has an inappropriate immune system response, and it has targeted your own tissues as something to attack. And it's also common to find a higher level of general inflammation occurring in the body with autoimmunity. In an earlier blog, I talked about inflammation and what underlies that. So when there's damage to cells or damage to tissues in the body, that's when you get inflammation, okay? And so when we're looking at autoimmunity, we're dealing with more of a chronic level of inflammation occurring in the body. And this affects different systems other than the primary system associated with that autoimmune condition. So for example, if we were to talk about Hashimoto's disease. So if that condition was only a problem of the immune system attacking and destroying the thyroid, then all you would have to do is take thyroid hormone, and everyone with Hashimoto's would be totally fine and happy with their level of health. But that's not the case. You'll often see other systems being affected by an autoimmune disease that really doesn't involve that primary tissue, so in this case, the thyroid. So in Hashimoto's, you could also see things like fatigue and brain fog and digestive problems and weight gain and insomnia and anxiety and depression. And see those, and all those are happening independent of what's happening with the thyroid and independent of what's happening with the thyroid hormone, because you can get the thyroid hormone adjusted, you could get it to optimal levels or even above normal levels and still have these symptoms. So that means other systems are being affected. In this case, you'd be looking at the central nervous system of the brain or the digestive system or other systems that are going to be impacted by just simply having an autoimmune condition. So now going back to how this would affect with a virus. So no matter how you would encounter the virus, either by being exposed to it naturally or even having a vaccination, you're still being subjected to the virus. Now, a vaccine they're using a weakened, safer form of the virus, but the bottom line is that for you to, one way or another, to develop immunity to the virus, your immune system has to get involved. Okay, which means the immune system is going to get engaged. There's going to be some level of an inflammatory response, some level of heightened immune reactivity. So where I'm going with all this is that, first, if you have autoimmunity, the best thing you can do is you really want to work with the immune system. You want to unburden the immune system. You want to support the immune system. Then with regard to this COVID-19 virus, what you want is you want to have an appropriate immune system response to the virus, regardless of how you encounter it, okay? So an appropriate response would be having relatively mild symptoms that don't last long, and you develop the antibodies to the virus, and done, okay? Having an inappropriate response to the virus would be a prolonged illness, triggering excessive inflammation, and possibly even triggering the development of another autoimmune disease, okay? The worst case would be of an inappropriate response would be mortality or death. So again, in functional medicine, we've always been talking about the importance of the immune system, the immune system, and it's even more important today with what's happening with this virus. So if you get nothing else from this, just understand that if you do have an autoimmune disease and you do encounter the virus, there's a chance that your symptoms can be exacerbated, but that's because of the virus and the impact it's having on your immune system, triggering a heightened immune response and an inflammatory response in the body. If you'd like some more information about the COVID-19 virus or other things you can do regarding autoimmunity, check out some of the other blogs. Thank you.